Hello, friends, and welcome to session 10 of our gut health series that we are calling Gut Logic. We are in these sessions, we've been talking all about gut health, the microbiome. We've been covering some of the most popular topics about gut health in this series with you. And this book club was inspired by this book that I was able to contribute to called Gut Logic by Mackenzie. So I had made a contribution to this book, as well as Dragana Skokvic-Sunjic, who is the author of the probiotic guide, the clinical probiotic guide for Canada and the US. Now, both Graham and Dragana are with me today, as they have been in previous sessions. And if you've been with us in previous sessions, thank you so much for joining us. Let us know in the comments where you're from and maybe what your biggest takeaway has been from these sessions. Also, if you have any lingering questions or doubts about gut health or probiotics, this is your chance to ask those questions. And we really do want to be able to interact with you in the comment section. We've had people join us from all over the world. It's been such an enriching experience just to have the audience be able to interact with us. And so thank you for being with us in the previous sessions and for joining us today for this final 10th session of our book series. Now, we will be doing a book giveaway at the end of this session. So we'll be giving you one lucky person a copy of Gut Logic, as well as Graham's first book, which is Healthy Logic, which covers quite a diverse array of health topics. It's a really good reference, I think, for someone to have at home. It's an evidence-based reference on a lot of different health topics, like supplements and a lot of different things that people have asked Graham as a pharmacist over the years, that he's just kind of gone a little bit deeper on than he could, generally go in the pharmacy. Because you may not know this, but as pharmacists, we're always quite busy. There's a lot going on in the back of the pharmacy. And so often the answer that we can give you to your question in the pharmacy isn't quite as in-depth as the answer we would maybe like to give you. And so that's why Graham wrote Healthy Logic and now his second book, Gut Logic. So before I introduce Graham and Dragana to you, I wanted to just do one last did you know fact about the gut microbiome. So did you know that the risk for colon cancer associated with every 10 grams of fiber intake is approximately 10%? So the risk reduction for colon cancer. This estimate is based on a systematic review conducted for the World Cancer Research Fund and American Institute of Cancer Research. And I thought this was interesting because we are seeing an increase in young people who are being diagnosed with colon cancer. And so, something just as simple as increasing your fiber intake. In session 2, Graham and I talked a lot about fiber and prebiotics. We talked about soluble versus insoluble fiber. Just by increasing your fiber intake, you can be reducing your risk for colon cancer. And there's a lot of other benefits to fiber that I won't speak about now, but that you can go back to session 2 and learn about, where Graham and I covered that quite in depth. So I just thought that you might find that interesting. So without further delay, I would like to bring the lovely Dragana Skokvic-Sunjic and Graham Mackenzie, the author of Gut Logic and Healthy Logic, onto the stage with me. Hello, Dragana. How are you doing today?
Hi, I'm so glad to be here, and I cannot believe it's the 10th session. It's the final session of this series, which, I was part of, but I learned a lot from you guys and from our guests, and it's been really enriching for me and for my practice, the things I've learned during these sessions.
Yeah, and it's been wonderful to have you and just for you to be able to share more of your knowledge with us. And I know those sessions that you did on women's health and on probiotics for specific health conditions, I did learn so much from those as well. Hey, Graham, how are you doing over there in Nova Scotia?
Doing good. Thanks, Lindsay. And yeah, Dragon has told us a lot of her in-depth knowledge on the whole topic of the microbiota. And I have to say, the speakers that we had on here that you were able to get on these sessions have been, I know they have educated me on a lot of topics that I wish we could have included in the book, and it was such an eye-opening thing, I think, for all of us to have these 10 sessions happen on top of the book. It was really great to have.
Yeah, and we've had great feedback from people who have won the book as well, and we're not trying to sell you the book here, we're trying to give you more evidence-based information, right, on gut health, and, because it seems to be quite difficult to find evidence-based information, especially across social media, but the people that have won your book, Graham, have been, just so grateful, and I've had multiple messages of people who just couldn't put the book down. It's written in a way that people can really understand, right? And we were talking before the show started about how, this is very similar to when we're in the pharmacy and we're just naturally talking to people, right? And I think that seems to be the approach that you've taken in writing both books. Both books are very easy to read. Would that be a
Yeah,
correct analysis?
it really is. The books are written as I was kind of instructed to write it in a way that the typical 14-year-old could read and understand. And I used to give sections of the book as I was writing it to my wife, Bev, and she would give me some feedback actually on, the stuff that you went into here is kind of way over what I think the average person would kind of understand. So you kind of have to dial it back to the way you talk to the patients in the pharmacy. And I think when you keep yourself in that frame of mind, hopefully you're making sense to the average person that's going to hear it. And I've had lots of feedback like you've had too. People have reached out about both books too, that we've given them to, and people that have purchased them. So hopefully we've done a good job with Gut Logic in making some sense to people that really had no concept of the whole idea to begin with.
Yeah, absolutely. And we may have some news to share on that book front later.
Yeah.
So we'll just hold that thought. Um, but yeah, and it's been just great to have the audience with us and to get those comments. But yeah, the guests that we have had on have just been extraordinary. And if you're just joining us for session 10, because I know we do have a lot of new subscribers since even the last session with Dr. Wishmeyer, if you are just joining us now, please do go back through the previous sessions because we've had just some incredible topics that we've been able to cover. Thank you, Julian, for showing these here. And every single one is its own little niche, I think, on the microbiome. And every single one is evidence-based. So there's no nonsense here. This is all based on the evidence to date. And it is such an evolving topic. And I think that's why, Graham, you said, I wish we had done this, before I wrote the book. But even if you had, tomorrow we'll learn more about the microbiome and more about probiotics, right? Dragana, you're the author of the clinical guide to probiotics. This must be difficult for you. I know that every year you have to do a new version of the guide.
That is correct. So the interest in probiotics as intervention has been always growing, and the offering of products is also overwhelming, and things change very quickly. This is why throughout the year we work on looking at what's new, what's published, assessing the evidence, contacting the producers to make sure that what's in the product is actually what has been tested in particular study. And then everything culminates end of the year when the last 3-4 months we meet, we review the evidence, then we prepare the final copies that give it to the IT department, which then makes it into the website and mobile apps that it gets published January 1st every year. So the last probably 6-7 years, we've never failed to publish the new updated version on January 1st every year. So it's coming up fast. Next year will be 17th version of the Canadian guide and 11th edition of the US guide. I'm hoping that maybe next year we'll have a first European version. So we'll see. It's really a huge interest in this particular reference tool, because again, everybody is talking about probiotics, but nobody knows what to recommend and how to recommend. Just like as a quick fun story anecdotes. Yesterday, I was at the conference in Montreal, and I was sitting with some young pharmacists, very bright, very smart, brand out of school, and I asked them 3 questions. I asked them if they are recommending probiotics to their patients. Few of them were saying, yeah, sometimes we do when we dispense antibiotics. And one of them says, wow, let me tell you, there's amazing reference tool. And he goes to show me and explain to me the Probiotic Guide website. So I was very pleased and very happy to hear that. So yeah, they were all like taken back. They wanted my signature autogram when they heard that I'm the author of that guide. But it's nice to see that even the young pharmacists are using it across the board. All healthcare professionals are using the guide as a reference.
Yeah, and go ahead, Graham.
I was going to say the point that you made there about science or information is always changing. And that was one thing that really, with the first book, made it difficult to know when it was finished. And because you don't want to have it published and then next week have something completely different come out. And this is something we learned a lot during COVID, that the average person really didn't quite understand perhaps how quickly things can change with science. And sometimes that would turn them off of science, but this is the way things work. We do our randomized placebo-controlled trials, which Dragana has on her site as references for all the recommendations they make. And, next year it might change. And that's why things get updated continually with science.
Yeah, just want to add something else is, even in a title of the clinical guide, it says it's a clinical guide to probiotic products available in Canada or US, and it says dosage formats, applications, clinical evidence up to date. Just to be clear, this is what we know up to date, and then it might change next month, next year. So, yeah.
Yeah,
Yep.
thank you both. Those are important points for people, and we do have a little clip coming up that just explains a little bit about AE Probio as well. But I wanted to start off with, if we can go back to some of the basic, the foundations of what we're talking about here. So I said earlier with Dragana and Graham, I said there's just one thing that I want people to take away from this. It is the definition for what a probiotic is. And so if we can look at this definition, if you can just try to remember this, tell everyone you know, because not everything is a probiotic. So probiotics, the official definition is that these are live microorganisms that, when administered in adequate amounts, confer a health benefit on the host. And that definition is very important because it's based on that definition that people like Dragana have been able to determine which strain is appropriate for which condition. And I'm not going to say too much because I know we have a clip coming up from you, Dragana. Actually, maybe we'll roll that clip now, and then we'll just have some comments, some further comments on this topic.
If we have a trial with a specific strain, and we say, wow, this particular strain, as for example, Dr. Wishmeyer mentioned, is minimizing risk of contracting COVID, or helps you recover from COVID faster. We cannot extrapolate this data to any probiotic strain on the market. So we never should say probiotics can help you this, or probiotics are good for that. No, we have to say this specific probiotic can be helpful for this specific reason. So this is one of the things we have to remember. Being a pharmacist, I like to always compare probiotics to medications. Each one is unique, and we have to have a specific purpose. I believe we discussed that in the past sessions. We don't tell our patients, I work in a primary care practice. I don't tell them, go to the pharmacy and take a medication. You have a high blood pressure, go to the pharmacy and ask them for medication. No, I give them prescription with specific name of the medication, dose, and expectations. So the same approach should be taken when we are recommending probiotics, or even selecting probiotics for ourselves for specific reasons.
I think that's just such an important point, because how many times do we see people in the probiotic section and they just look overwhelmed, or even pharmacists who don't necessarily know about the guide? How do you recommend something, right, Dragana? So it's just something that I think was just really, really important to point out. Any comments on that, Dragana or Graham?
Yeah, it's been my mission in life to educate about strain specificity and importance to recognizing what is and what is not probiotic. People are calling different kinds of fermented foods probiotics, recently raw milk was labeled probiotic, which is not everything that has bacteria in it is a probiotic. Some bacteria can be harmful, some are not present in sufficient amounts to provide benefit, etc. And again, if using probiotic for some reason, we need to know which one we're using and why. And I understand it is overwhelming because the selection and offerings on probiotic market in stores or online are overwhelming. And unfortunately, most of the time, there is lack of evidence that these probiotics, these bacteria, will actually provide benefit.
Good point. Yeah, I was just reading an article today, Dragana, about things that are written with headlines that try to get to the point as quickly as they can, and basically a very subjective article saying that probiotics really aren't that helpful for anything. And it can be really confusing for the general public when somebody who is a physician comes out with, or a researcher comes out with something saying something doesn't work, and then 10 minutes later they pick up something saying it does. So it can really turn people off of science and medicine overall when they see that. And I looked up many studies when I was writing this book, and the title of them would actually say probiotics do not work for a given medical condition. And the key to it is the specificity of the actual probiotic, the strain or the strains that are in the product, and the dose that is in the product. That is what is actually tested in the randomized placebo-controlled trials for a certain condition. And if that works for the condition, then that's what makes the recommendation. If it doesn't, then it doesn't make a recommendation. So we need firm evidence to show that it works, and that's what we tried to pull out in the book. And I get it can be really confusing for people when they're trying to get information, and not everybody can be an expert on everything. As pharmacists, we try to be the go-to person for virtually every medical problem they have, and it can be tough. But I think the background work we've done in this book at least proves that probiotics are fairly helpful for a number of conditions, and the speakers that we've had here have backed that up.
Yeah, and I think I saw that. I think it was a blog post or something this week that was saying that probiotics are not, not really very beneficial, and that is a very bold statement to make. When clearly the person had not, really looked at the evidence, right? Or
Yeah.
I just, and there's a lot of that out there, right? And so we've been very careful in these sessions to bring on evidence-based experts to really vet the people who we've allowed to come on, and just know that they're evidence-based, right? So, but like you said, it is confusing, and it is complex. And so if you've been watching these sessions, if nothing else, just understand that it's more than just taking something off the shelf, right? And also the importance of having that diagnosis. So what are you treating in the first place, right? And not self-diagnosing. So very, very well put. I want to go on to our second clip from Dragana here, where she's going to explain a little bit about AE Probio. And AE Probio is a free website. There's also a free app. And so this is completely available to any of you that are watching right now. And especially if you're a healthcare professional, if you don't have this open on your desktop or have the app or something, where are you really getting your recommendations from? Because it's, as Dragana has said many times, it's impossible to remember the strains and the condition, right, that they treat. So we'll go into clip 2, and then we'll come back.
And in 2008, the guide had one page, had 9 references. I'm not sure exactly, but it was very a small number of products listed that was supported by evidence. It's been growing ever since. We are now in 16th edition in Canada and 10th edition in US, and we have 24 pages and 250 plus references. So this just to illustrate the sheer amount of data and research that has been going on in the last 2 decades. The guide itself is the clinical decision-making tool. It's a reference tool. So basically helps clinicians, but also helps patients to select the appropriate product and also the dose for specific indication. And again, it is supported by the Alliance for Education on Probiotics, and the content of these guides is reviewed and updated annually. The reason for annual updates is because things change. Sometimes products that are on the market might change the strain that is present in the product or the amount of bacteria in the product that might warrant product being removed from the list or another one added. I mentioned earlier the inclusion criteria for the clinical guide to probiotic products is very strict. And all the points of the inclusion criteria has to be satisfied for something to be listed in the guide. The product has to be commercially available. Why is that? We often come across a study and it is with a very well-defined probiotic strain or combination of strains and with great evidence for some amazing indication. But then we realize that that particular strain, it's not commercially available either in Canada or US. And then we just have to park that study for maybe if that product becomes available. Also, we had great studies and research done on some strains with great evidence for cholesterol lowering done in Quebec and Montreal. And we had the product available in Canada for a short period of time, and now it's been discontinued just because of the low demand. So those kind of things make a first item in the inclusion criteria. It has to be commercially available, easily accessible, so the patient can actually go to the pharmacy or the grocery store or marketplace and then purchase it. Any product that we list has to be either natural product number approved by Health Canada, that means reviewed by Health Canada, or generally recognized as safe or GRAS status by FDA.
So that just goes over a bit of how Dragana has put together this guide, so you can understand where the information is coming from and how she ensures that it's accurate. Was there anything you would like to add to that? That's actually from Dragana's session, right? So if you look at the session on probiotics that Dragana did with us, you can go way deeper with her in that session. Anything to add to that, Dragana?
I guess one of the things I like to add as well is that there is a limited number of products that is listed in the guide, some 100 or something, compared to the thousands available on the market. And the aim of the guide is not to actually push or promote people using probiotics. It's almost the opposite, telling people that maybe they don't need probiotic, or if they are, spending lots of money ordering something online because their favorite influencer is pushing it and peddling it, they might not need it. It might be wrong selection for them. So ultimately, the guide will actually tell patients there's no need to take probiotics. So we have potential to save fair and substantial amount of money to our patients, maybe prevent some, unwanted side effects or complications or delay of proper treatment if the probiotics are selected appropriately or taken appropriately.
And that's something that's difficult as pharmacists sometimes when we tell people not to take something. Graham, I'm sure that you've experienced that before. Have you experienced that with probiotics?
Oh, definitely. Yeah. And, I think people are they come to pharmacists for a quick fix for something. And, be it hormone relief or, gut issues, which a lot of people have. And I think it's easy for someone to pick up gut logic and think, this was just written as a marketing thing for AE Probio. But really, the topic came up and I started writing it. And there really is no way that you could have written this book without referring to this site as often as I do. And I have to say, and I'm sure Lindsay feels the same way, how proud we are to have somebody who is a Canadian pharmacist that heads this up, that we can say this came from our country, and she's one of us. And it was one of the cornerstones of this book. And without that site, it would have been very difficult to write. And I'm sure Dragana in her mind is agreeing with me, but it's like, really, how could you have written it as easily as we could without that site? And kudos to you, Dragana, for having that information there.
Thank you. Thank you. I'm kind of a bashful here. And then, we as a pharmacist are always very timid and very modest. And, we often save lives, but we said, oh, it's my day job. So,
Yeah.
or like, oh, that's okay. Yes. So no, we don't often, say, oh, look what look what we know, look what we do. So yeah, we should be proud of it. And, I'm inspired by all the other pharmacists as well, you too included. And we, as a pharmacist, always say that we are such a sticklers for evidence, and we need to know there is evidence when we recommend something. And there are so many products sometimes we have in our stores because they are part of the big corporate planogram, but you never recommend them because we do know there's really lack of evidence for that. So it's interesting being a pharmacist. It's very interesting. Yes, for sure.
Yeah.
Interesting is definitely a good word for it. You never know how your day is going to go. Every day is different, right?
Yeah.
But we thrive on that, I think, in some ways. We're getting great engagement here from the audience, and I just wanted to say hi to Jim Jahaney, who is a fellow pharmacist and is joining us from LinkedIn. So hi, Jim. Thank you so much for joining us today. Patty Rivers as well. Her comment was just up a couple seconds ago. She's asking how long these sessions will be available. I guarantee that these will be up for at least the next 4 weeks. They are not going to be up. Not all of them will be always available. So I do encourage you to check out these sessions and just get as much from them as you can. They will be going on to a private platform after this. So they'll still be available, but they won't necessarily be directly here on YouTube. So if you want to stay up to date with that and with other content that I will be posting that might not necessarily be public, you can sign up for my newsletter. I have a free bi-weekly newsletter where I share different updates on not just things about the channel, but health updates. So you can sign up for that at friendlypharmacy5.com. And I just wanted to share as well that these sessions are not sponsored by any probiotic companies or industry. All of the guests that have been on these sessions, including our authors, have been donating their time and their knowledge for these sessions. And so that's just so greatly appreciated. But we do have a podcast. So we do have the Friendly Pharmacy 5 podcast, which is supporting and sponsoring these sessions. So you can listen to the Q&As from these sessions. Actually, all of them are up on the podcast. And you can listen to the podcast on Spotify, also on Apple. Recently, we just got onto Amazon Music as well and Overcast. And so prefer to listen rather than watch, that's also an option for you. And thank you for your support of evidence-based science in doing that. So on to our next clip. Now, Graham, you just mentioned that a lot of people have gut issues, and we see that all the time in the pharmacy. And it's really, I think it's about maybe 15% of people suffer from IBS. And mostly, I think it's women. And Dr. John Damianos from the Mayo Clinic joined us for one of our sessions, and he really went deep on the topic of IBS. And so I'm just going to play a clip from Dr. John Damianos now, and then we'll be back just in a moment.
Another reason that food can trigger symptoms in IBS has to do, again, with visceral hypersensitivity. So that oversensitivity of the nerves in the GI tract. We know that among the foods that are most problematic, foods characterized as FODMAP foods, so these poorly digestible sugars found mostly in fruits and vegetables, are not well absorbed in the small intestine. And this allows our gut bacteria to treat them as prebiotics, as food for the good bacteria, and cause gas and water to come into the lumen with an osmotic effect. And this can cause bloating, distension, and diarrhea in patients with visceral hypersensitivity. Dysbiosis or abnormalities of the gut microbiome can further this visceral hypersensitivity and maladaptive response to foods. So these people, at least in my experience, initially blame gluten But it turns out that in patients with IBS, the problem is not gluten. It's more of a multifactorial effect, particularly driven by the fact that it's a FODMAP. It's a fructan. It's the fructan in wheat that has that FODMAP effect, poorly absorbed in the gut, drawing out water, feeding the gut bacteria to produce gas. And that seems to be the main driver of why wheat in IBS is associated with symptoms. And again, it is more complicated than that. There are, again, these atypical allergies, as you saw in the other slides. And this slide here just shows some of the mechanisms by which wheat might generate symptoms in patients with IBS.
That was just such a jam-packed session with Dr. Demianos. If you or someone you know has gut health issues, even if they're not diagnosed officially with IBS, he even goes over some of the other conditions that are sometimes associated or can mimic IBS. I encourage you definitely to go back onto that. And, gluten sensitivity, Graham, is something that we seem to see a lot in our day-to-day and people adjusting their diets. And so I just thought that this was a really important clip to for us to just watch again and share with everyone about this low FODMAP diet. And you do write about that in the book as well.
Yeah, that really was a jam-packed session. I went back just to kind of, after we had done the session, just to kind of go over it again. And that, it really reflected, as a pharmacist, you really see almost daily people that have GI issues. And that's really a very loaded question when somebody comes to you, and having a diagnosis is really helpful. But when you listen to Dr. Demianos give the list of the mimickers and things like non-celiac gluten sensitivity, and sometimes stuff like that gets passed off as that's in your head, there's just something else that's doing it. But he really did a good job explaining how all these different foods can have a very drastic reaction with a lot of people downstream in the large bowel, and it really made sense to, I think, a lot of people that were watching that session, why they were having the problems they were. And sometimes you don't necessarily need medication to help get rid of those symptoms. You just need a change in your diet. So hopefully this gives us a little bit of cloak. We're not recommending necessarily a medication. We are pharmacists, and we're saying, sometimes just changing the diet that you're eating is enough to change those symptoms, and also to change the gut flora to something that's more favorable. So yeah, that was an awesome session.
Absolutely. And he does also talk about the Mediterranean diet in that session as well, and kind of compares different diets as well. So if you just go back and watch that session if you have had the chance. You will not regret it. And I know, Dragana, you've done some work with Dr. Damianos. He writes reviews as well for AE ProBio, and that's a great resource as well. I've been able to read some of them, and they're just excellent. I know he's one of the contributors anyways. Yeah.
Absolutely. He's been in touch with us for many years, since he was actually a medical student, because his interest in a gut microbiome and everything else we were doing. So we invited him to collaborate with us in, even throughout his school and then residency he was at Yale, and then now at Mayo Clinic. So he also volunteers with us on our scientific advisory committee. He writes quarterly research review, so basically goes over the latest research in probiotic area and does his commentary on it. So it's published with our AE ProBio Quarterly, which is online publication, and it's available for access on the website. So yes, he is absolutely amazing. And again, every time we ask him to participate, to educate, to do webinar or something, he is first to say yes. And again, great way of delivering sometimes very complex messages. So absolutely.
Yeah, Dr. Damianos, if you're watching, we greatly appreciate all of your work and all of the knowledge you shared with us in that session. We have one more clip from Dr. Damianos. So, peppermint oil, peppermint tea, are these things helpful for IBS? Well, what does the research say? So let's listen to Dr. Damianos.
Peppermint oil is a very interesting compound. It's usually a hybrid of spearmint and watermint. L-menthol is one of the active ingredients. And there are numerous proposed mechanisms of action of why it works in the GI tract. There's a calcium channel antagonism effect. There's activation of the endogenous opioid system. And there are some purported anti-inflammatory and antimicrobial effects. Peppermint oil is one of the most common supplements that patients take on their own, whether directed by a healthcare provider or not. The ACG recommends peppermint oil. The British Society recommends peppermint oil, and the Canadian Society. So we have guidelines recommending peppermint oil. In this meta-analysis here, peppermint oil was superior to placebo for global IBS symptoms, superior for improving abdominal pain. It's important to note here, though, that just because something is natural doesn't necessarily mean that it's completely harmless. Adverse events or side effects were much higher in the peppermint oil group, with a number needed to harm of about 15. This slide here includes some of the formulations of peppermint oil that were included in the meta-analysis. Now, there's a lot of controversy if you look deeper into the peppermint oil literature, because there's a lot of bias, which is true in a lot of supplement studies. There's also heterogeneity into where the supplements are being released. There's a small intestinal formulation where you bypass the stomach and have the peppermint oil released in the small intestine. And there's some evidence that perhaps that's a superior mode of delivery. But if you look at all the studies included in the meta-analysis, there's very low quality of evidence. There's a lot of heterogeneity in methodologies. Adverse events are very common. And then there's also because of all of this, there may actually be no effect of peppermint oil. Some studies have looked to compare it with other treatments and find that peppermint oil, it beats out fiber and some medications even in being the best treatment for IBS, and that it's a very cost-effective option. Now, could this all be a placebo effect? Now, why might this be? IBS, being a disorder of gut-brain interaction, is very influenced by psychological factors. In fact, there's a strong placebo effect in IBS. And this study looked to address that. It was a study out of a lab at Harvard that was studying whether the effect of peppermint oil is placebo. They gave people peppermint oil, they gave them placebo, and in both groups, there was a very dramatic effect on improving IBS symptoms. But there was no difference between the placebo group and the IBS group, the placebo group and the peppermint oil group, rather, suggesting that perhaps the peppermint oil effect was driven by placebo.
Very interesting comments from Dr. Damianos. The power of the placebo effect cannot be underestimated, I think. Any thoughts on this, Dragana, Graham?
Yeah, if I could just jump in there first. I remember Dr. Damianos giving a presentation a few years ago. It might have been during COVID, where he brought up peppermint oil and its use. And I think the biggest part of that whole presentation of that session that I remember is that section where he talked about the possibility that peppermint oil may just be a placebo. And I think it was good for him to at least entertain that idea that, you know, here's the evidence, here's a possibility of what might be happening. We do have a commercially available product that we use for IBS that has peppermint oil in it. I've recommended it to patients, and clinically I've seen results with it. It's just, IBS is just such a complicated issue that thinking that you can just give peppermint oil for it and all your problems are going to go away. I think the point he's making is that that's typically not going to happen with everybody. And I think it was good of him to point that out.
Absolutely.
Yeah, and
Go ahead.
with the gastrointestinal issues, it's that research is also kind of ripe with a very high placebo percentage of placebo having effect. So it's interesting. And again, another interesting tidbit of information: a couple of centuries ago, it was a pharmacist, a French pharmacist, that actually started, dispensing placebo patients that for the chronic conditions that there was nothing for them to offer. And he observed that giving the patients just a plain water in with a dropper bottle, telling them this is great, they were actually getting better. So yeah, pharmacists are funny.
I know when we first started, 30 years ago, when I first started working, we actually could order placebo in, and it was a fancy looking capsule.
Yep.
I think blue and pink, I believe, and just looking at it made you think it was going to work for whatever you're taking it for. It wasn't used very often at all, but yeah, the mind can give you almost, they say, a 20% placebo effect just by taking something. Just by taking a sugar pill, you could get sedation. So this is why we use randomized control trials to help tease that out.
Yeah, it's a very interesting topic, this whole concept of the mind and the placebo effect. It's quite fascinating. People think of it as, it's an insult when we mention placebo.
Yeah.
It's not. There's a reason why we use a placebo in our RCTs, right? And it's actually a really fascinating topic, the use of this for even chronic pain or something like that. The ethics behind it get really complicated, right? But it's very interesting for those who are curious. Graham, you asked Dr. Damianos a question about the infamous term leaky gut in that session. And so we just have one last clip from Dr. Damianos where you asked him that, and his answer was quite interesting. So I'll let you all have a look at that.
You spoke about leaky gut, and Lindsay and I have discussed this issue in the past. And so leaky gut is something that I think we can agree is probably extrapolated on a little bit. Could you tell us, what is it that we know and what we know happens and what we know doesn't happen from increased intestinal permeability? Does it actually cause disease?
Mm-hmm. Yeah, that's a really great question. It's one that a lot of really smart people are thinking about and researching right now. In particular, to bring back Dr. Camilleri here at Mayo, he's pioneered a lot of research on intestinal permeability. And he was recently featured in a nice National Geographic article on leaky gut physiology. And so I encourage you all to look up this National Geographic article where he and some other experts answered these exact questions. But the problem with the idea of leaky gut is the so-called leaky gut syndrome. And so this is essentially an idea that increased intestinal permeability is attributable to, or is the cause of, chronic non-specific symptoms across organ systems. And it's a way that a lot of pseudoscientists can target people with chronic illnesses to sell a supplement or a protocol or something by saying, all of your symptoms are attributable to, this increased intestinal permeability. We know that that's not true. We do know that the physiology is real of increased intestinal permeability, allowing for the leakage or the seepage of dietary antigens, bacterial toxins, etc., into the bloodstream and causing immune activation. But there's a very strong bidirectional relationship, and we don't know all of the consequences of it. In fact, there are physiologic times when the permeability is increased, exercise being one of those. Strenuous exercise causes leaky gut physiology. Well, all of our best athletes internationally are not plagued by chronic illnesses because of this, because they're more commonly in this leaky gut state than the rest of us. So it's far more complicated than just, is there increased permeability or not? And Dr. Camilleri has actually been developing a test of intestinal permeability to help address some of these questions. And part of the research that I'm involved in at Mayo with him includes using this test to see the effects of increased intestinal permeability. So in and of itself, we can't use it as the scapegoat that it's causing various disease states. There is not evidence to say that. Is it an important contributor to pathophysiology for certain disease states? Yes, that is true.
I'm so glad you asked this question, Graham, because he really brought so much clarity to something that if you do a search online about leaky gut right now, there is so
Yeah.
much conflicting information out there. There are so many cures for your leaky gut. And, it worries me that people might not be seeking an actual diagnosis because they buy into something like this, right? Like leaky gut.
For sure. And you and I toyed with the idea of having an evening where we would talk about leaky gut, and I tried to steer away from it so that I didn't have people thinking what he was explaining there, that leaky gut was causing this. And I think I'm guilty. 30 years ago when I graduated, you're always looking for something that has an explanation that maybe is new, and it's the same thing with adrenal fatigue. And if somebody gives you a list of symptoms or diseases, and they give you a physiological process of how it would occur, and in this case, leaky gut. So leaky gut being the tight junctions that keep all of your cells together in your intestine. They start to break down, and all of these things leak into your bloodstream, and your body reacts to it and causes autoimmune things like arthritis. So the symptom of leaky gut we know exists. The reason I asked that question is I wanted it to come from him, that all of those diseases that you read about online, like you said, that leaky gut causes, simply is just not proven. It would be great if things were that simple and all we would have to do is just solve the leaky gut issue. But then all the athletes would still have all this issue, right? So he made a very good explanation in how the leaky gut exists, but all the other bad stuff that it leads to, just we have never proven. So I really think the way that he explained that was very simple and effective.
Yeah, I agree with you. And again, it's the leaky gut syndrome or leaky gut issues are one of those buzzwords that, like the clickbaits that online influencers use to get engagement, sell something or push something. It goes along with the, quote unquote, immune system boosters or all these kind of buzzwords that, offer oversimplified explanation and solutions, of course, to push something that really has limited or no evidence at all. Yes, I'm glad that Dr. Damianos explained this beautifully.
Yeah.
Yeah, and it reminds me of an interview I did with Dr. Ids recently. So Dr. Ids is a physician from the UK, and he debunks a lot of myths about nutrition. And at the end of that interview, I asked for him to explain or talk about some of the red flags. So to watch for when you see, these people with these messages online, and they are positioning themselves as some kind of, expert, right? And what to watch for as far as, what are they selling, or like try to look behind the curtain to see, what is their expertise really. A lot of people will just say they're a wellness expert or something like that. I mean, anyone can put a message like that out online. And like you guys said, leaky gut is a term that really there's a lot of attention and emotion loaded into this. And so in what we're saying here, we're not trying to be dismissive of anyone's symptoms, but to, just question whether, maybe your symptoms are being caused by something that really needs a diagnosis. And it's not just like a Band-Aid approach, right? And so it's a topic that I'm glad we touched on it in that way, Graham, because I think it just brought a lot of, good information to a topic that is rife with controversy.
Yeah, and I think it's natural. One thing I've learned as a pharmacist is that people do really think that they can tease out a quick fix to something, and that there are things that physicians miss or that they're not taught in medical school. And I think there's always topics that we could debate with physicians, that maybe something works and something doesn't. But when it comes to again a cluster of symptoms, and people say, you know what, I have that, I don't sleep, and I have joint pain, and I have brain fog, and they tie it into something, it's no wonder how many millions of dollars are spent needlessly every year on things that just have a story behind them, a physiological pathway, but really no evidence at all. So hopefully we we helped in that small little segment of pseudoscience, helped to dispel that.
Yeah, and these things are complicated by the fact that in a lot of places in the world, including Canada, healthcare is just seemingly more difficult to access, and so people are looking online for answers. And unfortunately, they often fall into these traps or these lines
Yeah.
of thinking, right? And they're very well meaning. And so, like you were saying, Graham, hopefully we've managed to reach some people and provide some good evidence that makes them kind of rethink whether this is actually the case for their particular situation. I'd like to go on to our next clip, Dragana. This was from our women's health and probiotics session, which actually happened on the weekend of Mother's Day. So that was nice. But you gave us some information about chronic urinary tract infections and probiotics that I think would be really valuable for us to listen to again. And if you weren't there for this session, pay attention to the next couple minutes here. You won't want to miss this.
If this probiotic combination of those two strains is working to support healthy vagina, how about the rest of the urogenital tract? So but the researchers have done study looking at giving this combination of strains to minimize the recurrence of the urinary tract infection, or UTI. So basically, is using this probiotic as a prevention for the bladder infections. And what I also measured antibiotic resistance in those patients that we sometimes need to use the antibiotics, and we end up with running out of options because those bacteria will develop resistance. So the study had interesting design. So basically, that was a double-blind dummy study with the non-inferiority. So we had 252 postmenopausal women, so older women with recurrent urinary tract infections. And for that population, we only have options of antibiotics, sometimes low dose, long term, which will then cause other potential problems and complications. This particular study was 12 months and with 3 months follow-up. And we were looking at incidence of symptomatic infections and also looking at antibiotic resistance. So what the results of this study was that both groups, antibiotic and probiotic, reduce the incidence of bladder infections. Statistically looking, the non-inferiority target was not reached. But again, as you can see, that the treatments were equally effective. And what is also even more impressive, that we, using antibiotics, we then ran into the development of antibiotic resistance. So this bacteria stops paying attention to the treatment and then starts thriving again. However, that was not the case if we were using probiotics. There's really no antibiotic resistance developed in that group. So very encouraging data from that particular study. And I can tell you that, we've been recommending this particular combination to our elderly patients with the catheters, with the other complications, with the great results.
That was such a great session on women's health and probiotics. Dragana, anything further to add to that clip?
So with this particular clip, it is also interesting. It is illustration that when you take a probiotic that has good evidence and it's strong and effective by mouth as capsule, you swallow the capsule, you actually have effect in your bladder. So it's really interesting, and it just shows that everything in our body is connected. We cannot look at one system separately from others. As one of the authors says, what happens in the gut doesn't stay in the gut. So it's really interesting how much you can influence and how much you can actually prevent or treat with a very careful and specific, precise selection of probiotic strains.
Graham, any further thoughts on that?
Yeah, that's always kind of a almost like a magic trick when somebody is taking something for a prevention of a bladder infection, how taking it orally could change the flora in the bladder and or to prevent the urinary tract infection. And the microbiota has a way of distributing itself around the body very effectively. And as patients get older, as we see and we look after nursing homes in our pharmacy, the incidence of bladder infections increases with menopause. And, vaginal estrogen is one way to help that, but probiotic and the actual two that are in this that you mentioned in this study are available commercially, and we use it at our pharmacy. And it's a lot less side effects or a lot less issues trying to get a probiotic than a hormone vaginally, but both are very safe to use. And that when I was writing the book, this was one of the key areas that I hope would be a takeaway for some practitioners, is that you can actually give probiotic to help reduce urinary tract infections that are recurring in your patients, especially the ones that are in menopause or beyond.
And Dragana had mentioned like this can be life changing for people, and you've seen that in your practice, right, Dragana?
Absolutely, especially in elderly population, bladder infection, and again, it goes for female and male. It can be devastating. We have elderly patients that maybe have indwelling catheter or something, and any infection will get them in a hospital. They get confused, they get all different kinds of symptoms, and can be yeah, devastating, sometimes even deadly. So preventing it's the best way to go. Absolutely.
Yeah, that was an excellent session. So you can go back to Dragana's session on women's health and have a look at that because she shared a lot more in that session that we're not able to touch on today. So if you're watching us, I want you to thank you so much for joining us. We would really love it if you would interact with us in the comments. If you have a question for myself or Dragana or Graham, we are here to answer your questions today. We'd also like to know, where you're from. And if you do ask a question or let us know where you're from, make any kind of comment. Well, keep your comments, nice. But make a comment and you will be entered into a draw, which we will do at the end of this session to win a hard copy of Gut Logic as well as Healthy Logic. And so someone is going to win a copy of these books. We've been doing a draw at the end of each session. This is our final session. So let us know where you're from, even just what your biggest takeaway has been from these sessions. We would really love to hear from you and interact with you in the comments. So Dr. Paul Wischmeyer was also with us from Duke University for 2 sessions of our series. And the next clip that I want to show you has to do with the use of probiotics for the prevention of respiratory infections. And I was a little bit skeptical about this, but he presented quite a good case for this. So I'll let you listen to it. You can be the judge, and then we'll talk about it after.
So again, compelling data. And it began to make us think that not only could this help in this setting, but perhaps it could help in other viral infections like COVID-19. And that ultimately led us to begin to do some research, which we'll talk about later, because I think the reality is all of us were a setup for the COVID-19 pandemic and for many of the different viral pandemics like influenza and others that are going on, because many of us live in the industrial society we live in, where we eat sort of a very poor Western diet. We take antibiotics from time to time. We have other illnesses. All these illnesses significantly affect your microbiome in a negative way. They cause dysbiosis. And this sets us up for immune dysfunction and infectious risk. And then COVID-19 appears. All of us are set up to be susceptible to COVID-19. And that's why people with these other comorbidities got sicker. And if you hadn't received a probiotic, or if you didn't correct your dysbiosis, we found that you had much more inflammation in your lung and other organs. Your ACE2 expression, which is how COVID infects you, went up. And in fact, it appeared that patients with severe dysbiosis had much worse outcomes from COVID. And so we hypothesized that not just in COVID, but probably other viral illnesses, that if we could correct that with a probiotic, we would reduce the severity of illness, we would reduce the infectious rate, and we would improve outcomes in these patients. And so is there other literature for probiotics improving viral respiratory infections? And the reality is there is. This is a large again, Cochrane, the most well-respected review of the data that exists, 13 trials, 3,000 patients. Probiotics reduce an upper respiratory tract infection episode in healthy individuals by 47%. They cut your risk in half. So if all of you took a probiotic every day, you would have your risk of getting a viral infection, influenza, and all the other things that people get throughout the year that lead to a lot of the complications and illnesses that we see. And in fact, it reduced the duration, not just people getting sick, but when you did get sick, the length of time you were sick went down by about 2 days. So this is just one large meta-analysis. There's another large meta-analysis, now 10,000 patients, that shows that symbiotics, pre and probiotics, like given in that Nature paper, reduce respiratory tract infections about 16% in all comers, kids and adults, and about 32% in adults alone. So you can significantly reduce your risk of getting a viral respiratory infection if you take a probiotic daily. And so again, this data was quite potent. Based on that Cochrane analysis, an economic modeling group said how much money could the US save if everybody took a probiotic every day? And what they found was the cost savings for healthcare payers, insurance companies and other groups, would be about $370 million. This is like Medicare and other groups. It would avert 54 million respiratory tract infection related sick days, 54 million. It would reduce antibiotics use by about 2 million antibiotic courses per year. It would reduce work absences by $4 million and save the US about $1.4 billion for what would really be a very minor investment. So again, the potential ramifications of us improving our microbiome with a simple probiotic are pretty immense. And so this was really compelling data, I think, from a healthcare systems point of view and preventive medicine point of view.
So one of the interesting things about doing these sessions with our experts is that I don't usually see their slides more than 5 minutes ahead of time. So I had not seen this. I had not seen this evidence, nor did I know this. And this just really blew me away. And before we talk about this, I want to remind you that the sessions are not sponsored. We have no affiliation with any probiotic products or industry, right? So Dragana, had you seen or heard this before? Was this news to you as well?
So a few things. One of the interesting things, the economic modeling study, the initial one was done in France and years ago, and this was very interesting. Then we actually asked the same researcher, a lady from Belgium, to help us with the A Alliance for Education of Probiotics, for AProbio, to do similar analysis for Canadian population, providing her with some of the data that is readily available, sick days, etc., and healthcare costs, and the probiotic use in Canada. So the modeling study was published in 2015 for Canada with impressive results. A few years later, we also supported the different group of researchers with Dr. Gregory, Dr. Merenstein, etc., looking at the US data with the same lead researcher. So those are kind of economic modeling studies. And what Dr. Mishmeyer mentioned at some point is there are specific probiotic strains. And the two meta-analyses that we used for the modeling study were by using a few different kinds of probiotics that are listed in a guide under the common infectious disease prevention for kids and adults. So yes, I've seen those studies before. I've been involved in preparing them and publishing them in the background. The study that he's done throughout the COVID, at the beginning of COVID, that was onset was before we had vaccines, when we were desperate for any kind of intervention. I was really encouraged to see some preliminary data from that group. And then again, post-analysis showing and proving the benefits of that LGG strain in minimizing the risk, or even minimizing the risk of infection. And if you do get infection, you have better outcomes with that.
Graham, what were your thoughts when he dropped this bomb on us?
The thing I like about Dr. Wishmeyer is that when I was writing the book, I knew that we had ventilator-associated pneumonia and perhaps kids preventing respiratory tract diseases, which is not a stretch. To come out and say that your COVID was going to be less severe because you're taking a probiotic, I'm quite active online, and I felt I would have gotten bombarded. Dr. Wishmeyer just comes out and tells you it will actually help. He's not afraid of what he was going to. He said, this is the data that shows that it helps with COVID patients. And he's right. So I think the one thing about that is that both Dragana and I think from some of these sessions, whenever the question was asked, should you take one every day or should you take it when you need it? We would always lean towards take it when you need it, except for, I suppose, traveler's diarrhea, maybe antibiotic associated diarrhea prevention, maybe eczema, that kind of thing. But through his sessions, it really laid out a framework of taking probiotics for more than just an immediate problem that you have. It was to prevent a problem and being ready for it and not starting from behind the 8 ball when you get the infection. So that's really something that kind of, I think I learned more from these sessions than when I was writing the book. It was really, he just comes up and tells you, here's the data, and there's no believing it or not. Science says here it is. So it was kind of good for him to say that.
That's correct. And sometimes there is this there's no need to take probiotic daily, but if you are going into the flu season in the fall, or kids back to school, that might be time for a couple of months to take a probiotic, or if there is again flare up of some kind of a new strain of COVID or something, and that might be a good time to take a probiotic for it. That's for sure. Dr. Wischmeyer was also a guest to our COVID panel a year ago with the APROBio, where we invited people involved in research with using probiotics in COVID treatment or prevention. And we had a great discussion. We had Dr. Espadal-Hermazo from Spain. We had Dr. Wischmeyer, Dr. Damianos, Dr. Reed discussing it. Dr. Peter Lynn was actually moderating the session, which we learned a lot, and made you think about different kinds of impacts that intervention with specific probiotics might have in this specific area.
Yeah, it is interesting. And we know that, these viral infections, Dragana, you were mentioning respiratory season or flu season, these viruses do impact the gut. And we know even with long COVID, they're looking at persistence of the virus. And one of the issues is a lot of people after having COVID or while they have it do have severe gut symptoms. And some of these symptoms have persisted. So to see some evidence coming in for this and how you could possibly mitigate some of that is quite encouraging, right? Because the risk is low, and it's a lot of these products are quite accessible for people, right? So I would also encourage people go to the AEProBio website, because you can watch that session again, and I watched it and it was just phenomenal. So if you want to go and check that session out, it was just incredible. Yeah, definitely. And the session with Dr. Wischmeyer on respiratory infections that we did, also just buckle your seatbelt and listen, because it's quite loaded.
Watching it more than once was something I had to do. It was just, there was this bang, 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 like all that information was coming. So I just had to kind of go back and digest it a little bit better. But man, there was a lot of information in those sessions.
There was, and then we were joined in a recent session by Dr. Peter Lynn, who you just mentioned, Dragana, and Dr. Lynn was just a wealth of information. He talked about early life and how that impacts the microbiome. He talked about GLP-1, which is something that we'll show a little clip on in a moment, and then he touched on the topic of microplastics, which has been all over the news. We've been hearing about this, how they've been finding microplastics in a lot of different places in the body, including in plaque formation in the arteries. So let's listen to that clip. And it was very eye-opening to hear what he had to share about this and how this is potentially linked or could affect the microbiome.
Now this one's interesting. So what about plastic? We were talking about this microplastic business. So it's showing up everywhere. You're seeing it on TV and stuff like that. And you've got all these little acronyms that nobody knows what it means. And so just to give you the background, everything is poly, meaning many. So it's polyethylene, which is PE, polypropylene, which is PP, polyethylene, and you can see that everything is poly, And then it's whatever the molecule is that it's making copies of it. Polyvinyl chloride, PVC pipes, we all know that one. And if you look at this one, this is what polyethylene is. This is ethylene, and poly just means many of these connected together. So plastic is basically many repetitious of the same unit that's here. This is propylene, okay? So this is polypropylene. So many of these things connected together, and these are the other ones that you can connect them together. And they have different properties. You can see them as styrofoam, styrofoam cups and things like that. Some are clear, some are not clear. So therefore that's being used everywhere. And the problem is that we've been talking about it is in the nature, you see horrible pictures of birds and fish being tangled in the plastic thing. And we were always told that it's a long process, right? So we dump it in there, it breaks into small little bits, then the fish eat it, and then we eat the fish. So it makes it sound like it takes a long time for us to get the microplastics into us. Unfortunately, we are the first users of the plastic, right? So we're the first users, and then we throw it into the environment, and then the fish is like a second-hand user, and then we become third-hand user when we eat the fish. But we're the first-hand users of this plastic, so therefore it might make sense that we might have the plastics within our body as well. So this is a paper that was just published in March of this year, talking about microplastics in the carotid arteries of people that were going for surgery. So, in the arteries of your neck, sometimes cholesterol builds up. So this is normal looking. You could see cholesterol building up. So one way to prevent a stroke from happening is if it's really blocked, they go in there and they remove this. They actually take out that plaque and then put in new piping, I guess, if you will. So then you don't have a chance of popping and causing blood clots going up to your head. And so at this facility in Italy, they said, why don't we do that? But we'll send this to go look for plastic inside there. So they were wondering whether there's plastic inside there. So they used a big fancy electron microscope. And lo and behold, you could see these are chunks of plastic inside the plaque of these people, where they took it out. And this is the plaque outside of the macrophages. So we have macrophages. These are like army cells that have eaten up all the cholesterol. So you could see these little bubbles of cholesterol that it's eaten up, and it gets stuck in the plaque, okay? And so what happens is that you can see the plastic here outside these macrophages, your army cells. And then here you could see it inside the macrophages. These are plastic that's inside, and you can see the oil bubbles that are inside the macrophages. So that's very concerning. So not only is it in there, it's also in the cells that are part of our army cells as well. Now, they looked at what type of plastic. So polyethylene, or PE, is the most common plastic in the world. And so therefore, about 60% of these people had it. And this study was, I think, 230 people or something like that. So 60% of them had this one in there. Polyvinyl chloride, or PVC, out of this 150 or whatever, about 30 of them had this one. So they had two plastics in them, okay? And 60% had one plastic in them. So is there inflammation in the plastic? Is it causing trouble? And so these are people without microplastic. These are with. And you could see without, there's very little inflammation, but with, there is much more inflammation going on. And wherever you have inflammation around plaques, we always worry that plaque is going to bust. And therefore, you're going to form a blood clot to seal it up. And then that blood clot flicks off or clogs up, and then you have a blockage. So that's why we worry about inflammation. Then they also looked at the collagen. That's what makes your skin, tight and, firm, I guess, if you will, with the collagen injection. So the more collagen you have in the artery, the tougher it is. It can withstand some pressure. So without microplastics, it's very good. Lots of collagen, and the red stuff is the collagen. On the other hand, patients with the microplastics have very little collagen, and it looks like this. So this pipe would be more likely to burst than this pipe. This pipe is tough. The other one is not. So therefore, that's of some concern as well. And then what about heart attack, stroke, and death after their surgery? In other words, they waited, 3 or 4 years to release this study. They said the people with plastic in them, did they do just as well after surgery, right? Because the whole idea of the surgery is to prevent strokes in the future. And what you can see is these are the people without plastic in them after the surgery. So their event rate of heart attack or stroke or death is very low. But you see the people with microplastic in them, their event rate is much higher. And so this is about 4.5 times higher risk than these people. So they all had the same surgery to take out that blockage. but the people with microplastic in them are 4.5 times more likely to have more problems in the 3 or 4 years after their surgery. So now this becomes something that we could use to identify people at high risk, because they probably have plastic in other places, and those other places might clog up and therefore cause heart attacks and strokes and things like that. And so what do you think happens with all this plastic that we go through? Well, the hot water bottle and stuff like that, the microwaving of your plastic containers that get very hot. And you know how when you take it out of the microwave, it's kind of soft? The bottles in your car on a summer day is very soft. And here's some holes in the styrofoam that were burnt by these very hot little balls of sesame seed balls, and microwave washing of plastic. Now, there are some that you can wash, but a lot of times you're now breaking down the plastic, and sometimes it becomes rough. And so that means some of the plastic has come off. Those ones will go into the water. And then the rough surface, if you put food in it, then you'll probably eat it. So anything with high temperature and plastic, you might leach out more of the plastic, or at least the sort of chemicals from the plastic. And what do you think it'll do to the microbiome? So the microbiome, basically, if we can find it here, then it's going to be either breathed in or you ate it in. So in the feces, they can see plastic inside there. And the problem with the plastic is that it allows a place for the bacteria to hang together, so that they can cause these biofilms, which is a layer of bacteria that hang together, and they can produce a lot of chemicals that may be harmful. And also the plastic may change, of course, the population of the microbiome, right? Because people that can hang onto plastic may not be the good bacteria. And so therefore we might get into some trouble that way.
So this was a fairly recent report that had come out, and Dr. Peter Lynn was able to flag this and just explain this a bit more to us. So really appreciated his insights here. It definitely caused me to change some things around in my kitchen and my practices. But it also goes to show how we're still learning a lot about, the microbiome and what can impact it, and how, different environmental factors. In that session, he also went over pollution, and how that can impact our health and our gut as well. So I encourage you to go back and listen to that. Any thoughts on that one, Dragana?
So with Dr. Peter Lynn, I always loved his presentations on any topic, because he brings very complex and involved subjects to such a beautiful breaking down explanation, easy to understand, and I absolutely love his style of presentation. So, and he's very current. He, as you see, the study was very recent. And again, very impactful. And the same thing, always makes me go back and rethink my practices, my habits, my things, what I do, what I drink my water from, etc. So it's yes, it's interesting. Some things you cannot really completely avoid, but makes us more mindful and more careful in our everyday practices. Absolutely.
Well said, Dragana. Yeah, Graham, I know that you and I were sharing some messages about, changing out some of our cutting boards and things like that, right? Very
Yeah.
eye-opening. Mm-hmm.
It was the one session that I really felt that I was completely losing complete control of anything that I had to control my health. It was just I was like, okay, plastic is everywhere. And so then I thought, okay, we have to at least stop plaque development, which, is something that we can do, right? But as far as avoiding plastics and all the different ways you can avoid plastics, like the microwave and the dishwasher, that kind of thing, and the cutting boards, we had exchanged pictures there of. It's just so eye-opening how using a plastic cutting board and the little tiny pieces of plastic that are left there, where do you think they go? Well, they're in the food that you just cut up on the cutting board. So, Dragon, I think you should have a heading that if you can find probiotics that eat away at microplastics in plaques, that should be a heading of your next edition. And the forest fires too. That was like all the stuff that it seems like I have no control over, and like now what do I do? So yeah, if you can find a probiotic for that thing, that would be really helpful.
Let's do that, and then let's get really rich and retire.
Yeah, we did talk about that with Dr. Lynn. He thought that would be a great idea, and so we'll be waiting on you for that for that. We'll do another session if you figure that out. Dr. Lynn also did share about GLP-1, which is a hormone, and so you might not have heard about GLP-1, but you probably have heard about Ozempic or Wegovy, or the weight loss medication. Maybe that would flag that for you. But he talked about GLP-1 and how it relates to the microbiome, and I know that Graham and I in session 2 we talked about. I touched on short chain fatty acids and how those influence the production of GLP-1. But as you said, Dragana, Dr. Peter Lynn just has such an amazing way of explaining things, and I'm so glad that he was the one who was able to break this down for us in this clip.
Now, how do we tie this to the microbiome? So this was a great paper in 2018 from Gut. And so what these folks said, here is your intestine. And remember the little L cell that I talked to you about? That's the guy that makes GLP-1, right? So there's the GLP-1, and that's the one that tells you to, lower sugar, you don't need to eat, all that kind of stuff, okay? Now, it turns out, who's telling the L cell that there's food around? Well, it turns out it's the microbiome. So the microbiome will produce these chemicals. These chemicals will work on some receptors that then tell the cell you should make the GLP-1. So not only does it give it signaling, it helps it to make the GLP-1 and then therefore give this. Now, what would happen if the bacteria are not there? So therefore, let's say we have a screwed up microbiome, then we don't have these little molecules that are sitting there in the right amounts, and therefore the signaling here is not in the right amount. And therefore you would tend to keep eating, thinking that there's no food sitting in the terminal part of your intestine. So you can see how the microbiome is helping us in terms of regulating whether we send out these signals or not. And I just show you this one example to show you how the microbiome that's sitting on this side of the gut wall can affect what's happening inside your body. And in this case, it's affecting something that's happening very far away. Another half of this is that if these guys are not being produced, it affects the lymphocytes. So these signalings will also, remember, teach your army cells what to do. And therefore we affect the lymphocytes and their defense mode. So they might not be as good. And so therefore now we have people with, higher sugars, higher weight, maybe not so good at fighting infection. And we're now describing a patient with type 2 diabetes, for example. So therefore the microbiome may be, at least in the beginning, sort of initiating some of these problems that we see in diabetes. Now, I wish it was just so simple. We correct your bacteria and everything's good. Eventually the system, it's kind of like having a something loose in your car. Initially, it's just the nut that's loose, but now everything is wearing out and now we have more problems. So fixing that original nut doesn't fix everything, because now you've worn out other components of the system as well. Okay. What about the coronavirus? That did a lot of bad things to the microbiome. And I know that you guys had a whole session on that. I just want to show one slide here. These are patients with COVID-19, patients without COVID-19. And you can see the sort of the types of bacteria that are sitting there versus the types of bacteria that's sitting here in the non-COVID. So you could see many more of these ones, whereas these ones that are flagged here are very low in the non-COVID patients. So in other words, there's a population shift. And could that shift not go back to normal, in which case we might have long COVID bowel symptoms as well. And so that's what we're seeing. Some people have these bowel symptoms that continue on. And could that be because the microbiome has shifted? Also, if your microbiome has shifted, remember, it's processing a lot of things for us, and we need it for all that processing for internal systems. So then if they're not processing properly, then the internal systems are going to be worse. So we saw more diabetes, post-COVID. So one possibility is that it kills your pancreas cells. Another possibility, it's messing up that signaling with the GLP-1, right, that we just talked about, because it's messing up with the microbiome. So you could see that the microbiome would be very important to look at.
I so appreciate that, because I don't think that many people link GLP-1 with the microbiome, right? Or with gut health. And it's going to be interesting to see what happens over the next few years as there's, new weight loss medications, that are coming to market and new technologies, but also keeping in mind the factor of gut health, right? And how feeding those good bacteria in your gut can help to, we know that feeding yourself with, say, fiber can increase satiety, right? And it can increase some of these hormones. So it's not simple, but I'm glad that he was able to explain it that way. Any thoughts on that, Dragana?
It just goes to show everything is connected to microbiome. Whatever we touched and talked about, there is some connection to microbiome or microbiome influence on risk development, prevention, etc. So definitely, things that are happening inside the gut have a far-reaching effect on rest of the body in many different ways.
Yeah, I've given explanations countless times on how the GLP-1 agonists work, and I've done it on CBC. I've explained it to people that have phoned in, but I've never quite done it the way that Dr. Peter Lynn has done. And it's really interesting how that connection with the microbiome can affect your weight. And one of the things that I was always kind of holding back on when I was writing the book was to not go overboard with the weight loss thing, because there were studies out there that would show 1 or 2 pounds of weight loss. And Dr. Wishmeyer talked about it, injecting stool from a thin rat into a obese rat, and it would lose weight. But that explanation of how those medications work and the connection that the microbiome has really points to the fact that there is more work to be done on making a specific recommendation. Is there an issue taking a probiotic and hoping that would work? I suppose you could, but we're always looking for firm recommendations on what to give and how much to give. So, and I think the same thing goes with the COVID as well. In that recommendation, we know there's something there. We just have to tease out what recommendation do we give our patients.
Yeah, and just to add to that, with some of the very few probiotics we have listed in the guide for the weight management, we call it, not only weight loss. But yes, it's moderate weight loss. But what's also impressive, it's a shift in a body fat percentage, which is more significant, far beyond expectation with that moderate weight loss, and reducing the waist circumference. So it's basically losing that kind of a visceral bad fat much faster than losing anything else, as opposed to, with other interventions, you might lose muscle as well as your fat. So definitely some promising data, some moderate effect with the product listed in the guide, and we are looking for absolutely more research that is going on right now.
Absolutely. So if you are just joining us, thank you so much for being part of this session 10, our final session of our Gut Logic series. If you would like to let us know where you're from in the comments, if you have any questions for us, we just have a few more minutes to go here. We're going to have one more topic that we're going to touch on regarding the gut-brain axis. But if you have any questions about gut health or the microbiome, myself, Dragana, and Graham, we all contributed to this book. Graham is the primary author. Dragana and I were able to contribute to this book as well. And we would love to help answer your questions to the best of our ability here. And then you will also be entered to win a copy of both Gut Logic and Healthy Logic at the end of the session. So this is the final time I'll mention it, but now is the time to ask your question, make a comment, even let us know where you're from or what these sessions have really taught you. We would just love to hear from you. And thank you so much for so many people joining us. I see someone from New Hampshire is here. We have people from Ontario, Canada, and just people from all over the world who have joined these sessions and just really helped it to be such an enriching experience. So our last session was with Dr. Paul Wishmeyer, and he talked to us about the gut-brain axis. And, a lot of different authors have tried to address this. And I know, Graham, you did speak about this in your book, and the interesting connection that the microbiome has with the brain, and how I remember Dr. Rishmeyer mentioned how the brain affects the microbiome, and the microbiome affects the brain, and there's this whole cycle there, right? And so listen to Dr. Wishmeyer explain how not everything that happens in Vegas stays in Vegas when it comes to the microbiome.
But the gut-brain axis is much more than just nutrition, right? And vagus nerve is the key nerve that connects your gut to your brain. And what we say is what happens in vagus not only stays there, but has it in the gut, in the body, it doesn't just stay there, and it has a huge effect on your emotions. And so what happens in vagus affects your emotions. It doesn't just stay in your intestines. And so there's lots of data to show that gut pathology is linked with brain pathology. And so anxiety and depressive disorders clearly are linked with dysfunction in the intestine. So for instance, irritable bowel syndrome is also commonly associated with anxiety and depression. And I think some people just thought that people who are anxious somaticized more, complained more about their intestines. Well, that's not true. The intestine microbiome makeup of people with IBS and anxiety is different than people who aren't anxious. So it's not all in your head. It's also clearly affecting your gut. Schizophrenia is linked with celiac disease. Autism, as we've said, is linked with lots of GI microbiome disorders. Probiotics can affect this. Again, even germ-free mice have a lot of changes that can be associated with similar things we see in schizophrenic patients. So not having a normal microbiome is bad for potentially your risk of developing psychological diseases. There was interesting studies that have happened when water supplies in cities have been contaminated with particular pathogenic bacteria. So what they found was in this particular town, was in Walkerton was the town, that the people weren't actually sick, but they were getting subclinical or sub-infectious amounts of a Campylobacter. And it led to significant increases in anxiety in the whole town. So anxiety can be produced by subclinical or infections you don't know that you have, leading to changes in your gut microbiome that you won't even feel that are occurring. And this was a really neat study, I think, that showed how anxiety is driven by the bacteria that live in our guts.
I remember from this session that Dr. Wishmeyer also mentioned a study where, they know that there's this connection with the vagus nerve, because if they actually cut the vagus nerve, this communication stops, which was just very, very eye-opening. Graham, any thoughts on that session? I mean, Dr. Wishmeyer always just brings so much information in, and if you have a chance to watch and you're here with us and you missed that session, definitely want to go back for that one. But Graham,
Yeah.
what were your thoughts?
Yeah, so the interesting part of that obviously is the snowball effect that you have, where the gut feeds to the brain and the brain feeds back to the gut. And we know that serotonin is so produced in the gut, but serotonin directly transferring to the brain is not something that necessarily happens, but the serotonin that is made in the gut through the vagus nerve is absolutely something that can affect what happens in the brain. So we do have lots of studies out there that show that there are certain probiotics that affect your mental state. And, I'm always one to let the patient know, if you're struggling with something with your mental health, this is something you should bring up with your primary care practitioner first. And as soon as you have a look at that and they make a recommendation, you always know that there is something that we can point to for some conditions regarding your mental health that probiotics can help. Maybe not all of them, but you shouldn't struggle on your own with self-care all the time when you have mental issues. And it's always good to bring in your entire healthcare team for that. That's one thing I tried to stress in the book, as well as balancing it out with information that we have with probiotics being helpful as well. So that was a great session to have.
Absolutely. And Dragana, I actually was on the AE ProBio website recently, and I know Dr. John Damianos, I found that he did a review, and he talks about probiotics in relation to depression and anxiety, and he explains some of the evidence for that, which is really, really helpful. So if people want to see that, they can go to the AE ProBio website and have a look. Any thoughts on this topic, Dragana? I know you weren't able to join us for this session because you were away speaking in nice place.
As I say, it's uh, always great. We keep learning more and more. But Graham said, as a pharmacist, we always want to make sure that the patients are properly diagnosed. They're not self-diagnosing and self-treating and delaying proper help, especially when it comes to mental health. However, in collaboration with the rest of the healthcare team for each patient, there could be an option to engage with probiotics, get that into the whole plan of action for patient. And again, probiotics, small part of it, diet, the balancing, and making sure you have the appropriate fiber content, and lifestyle interventions, medications, etc., always have a good place. Quite a few probiotics strains and products are listed with the mood and effect indication in the guide. And again, we do encourage prescribers to check the references listed for each indication to see what the population was, what was the design of the study, what are the primary outcomes. Definitely place for probiotic as intervention there as well.
Yeah, and excellent reminders there that if you are having, mental health symptoms, don't try to self-treat. You need to reach out to a healthcare professional or whoever is available who can properly diagnose and assess you, and there is help out there, right? So that's just very important to point out. And Dr. Wishmeyer, yeah, that session was just it was incredible. And even when he talks about how we know that how stress impacts the microbiome and how people do become symptomatic when they're under stress. It affects the GI tract and that kind of thing. And so many good insights in that session. So we're going to do our draw for the book, for the two books, Gut Logic and Healthy Logic, in just a few minutes. So now is the time to ask our authors your questions about gut health or about the microbiome. Make a comment, ask a question, and you will be entered to win in the draw that we are going to do just in a few minutes here. Before we do that, I want to thank Graham and Dragana and all the speakers who have been here for just making yourself available. Graham and Dragana, you that are here today, for sharing your expertise with us, for sharing your time with us. Graham, you wrote the book, and that's wonderful, and it's a wonderful resource. But having you here for every session has just really been invaluable. Dragana, you as well, and the presentations that you were able to share with us and how up to date you are on the research was just something that is just it's just so valuable and so lovely to have you here and to really learn from you during these sessions. So I want to thank you both, but I also would like to know what you guys are up to. I know we have a little project that we're going to share with today. So Graham, maybe you want to share about that. But Dragana, what's coming up for you? Is there anything that you would like to share with those who are watching today?
So again, lots of the same things, lots of education coming up, quite a few online, and monitor and follow maybe Probio social media to get information about probiotic education that we are organizing and participating in. There's another area of my expertise where I really am passionate about is women's health, especially menopause. So lots of things happening in that field, in that arena as well. Doing some talks on online for rounds or QID, which are portals for healthcare professionals, coming up soon. So interesting things happening and coming up. There are few questions. I'm not sure whether you have time to answer questions. So you let me know if you want me to tackle some of the questions I see.
Absolutely. We will get to the questions in just one moment. We have some actually excellent questions coming in. So keep those questions coming because we are going to have a short Q&A here. And Graham, what have you got up your sleeve? So you've already written 2 books. You've owned a pharmacy. You're in a magazine most recently. You're featured on the cover of Pharmacy Practice and Business. We're all so proud of you. So what do we have to look forward to? And how can people even reach out to you, Graham? Because I know that you are looking to do maybe more education like this. So how can people maybe contact you and keep up to date with what's going on?
Well, as always, I'm on LinkedIn and Twitter. It's usually the best way to get to me, and that's how I connected with most of you guys. In fact, I would also plug Julian Colsett. I've looked into Julian. He's our kind of producer as we
Come on.
have done this, and I think Julian should show a picture of himself while he's here. But he's kind of an amazing guy when you look up his bio. I never realized this whole time this guy has been working here, and he's done all this other stuff. So anyway, thank you, Julian, for everything you've done for
Thank
us.
you,
Like, you've
Julian.
really,
Julian has
I've watched.
kept it running. Yeah.
Yeah, I've watched Julian up to the very last minute of going to air here. He has helped the speaker get through their slides and everything, and just like that. So thank you, really, Julian. Thank you for everything you've done for us. Appreciate it. And to answer your question, yeah, the three of us have discussed another book, and I've always thought there'd be a third book come along, and I really had no idea. Dragana had suggested at one point doing one that is on women's health, which I think would be very timely. And we've reached out to Nardine Nakla, who is a very well-known Canadian educator and a pharmacist who has agreed to come on board with this. And I think among the four of us, we could come up with an amazing publication on women's health. And we have not really a timeline right now for this, but this will be our next project, all of us together. And to have you guys in on this, I just can't believe that I'll have this kind of knowledge coming in on this next book. So stay tuned for that. We don't know when it's coming, but that's what we're working on next.
Thank you for sharing that, Graham. And it is very exciting. We have covered some women's health topics on the channel, along the lines of patient advocacy, patient stories, and the topic of women's health is something that I think is so relevant, so current right now. Dragana is a certified menopause practitioner. She's very up to date. In fact, you mentioned at the beginning of the program today that you were just speaking about menopause at the Pharmacy U conference in Montreal. So this will be a really incredible project to be part of, and hopefully we can create another really valuable resource in addition to the ones that you've already done, Graham. So yes, I do want to get to these questions. We have some excellent questions coming in. So first of all, let's just see here. So we had this question. Is the microbiota of the gut linked to the microbiota of the mouth? I've stopped using mouthwash because I'm concerned about killing all of the bacteria, including the beneficial ones. I have some thoughts on that, but I'm going to throw that one to one of you first. Who would like to take it?
If I may start, and then I'll let Graham do the smart conclusion. There was a recent study, actually, recently in the news, talking about using mouthwash that is, not beneficial, that kills all the bacteria, etc. Specifically, it's alcohol-based mouthwash. It could be potentially problematic. We don't know to what extent. There are definitely friendly bacteria in the mouth that is definitely difficult to kill. There are bacteria that start with the presence in the mouth and then goes through stomach and the rest of the intestine. So how influential mouthwash would be, we don't really know, aside from this recent report. So stay tuned for that. But definitely what happens in the mouth, affects the rest of the microbiome and microbiota throughout the body. Graham, anything else to add to that?
So we have seen maps on these presentations of how intertwined the microbiota is between the mouth, the skin, in the gut, anywhere that you would have probiotics. And really anything that you do on a given day can affect that, not just taking a medication like an antibiotic or an anti-inflammatory agent, but as we learned, like living with a pet or being under a lot of stress or living in North America as opposed to a Middle East country. Every single thing affects your gut and your overall body probiotics. So I think if you at least keep that in mind. Don't get overburdened with one specific one, but yes, anything that changes it, like a mouthwash, using hand sanitizer on your skin changes your microbiota on your skin. So as far as proving what each specific thing does, this is why we've only scratched the surface of probiotics. So we know that it does affect it. Does it have a detrimental effect downstream? Hopefully we can find that out, but it's a good question.
Yeah, it is a great question. I think it was about a year ago, I interviewed Dr. Graham Lloyd-Jones from the UK, and he's a radiologist. And he has done some research into how oral health can be possibly connected to severity of COVID-19 infection. And I know that he's really gone down this this pathway of the importance of oral health. And so there has been some evidence, I know, during COVID-19 that the use of mouthwash during infection may reduce the severity. And there was actually some research out of Brazil that was showing that there's some use of a particular mouthwash, they were using it in hospitalized patients, seemed to help reduce the severity and duration of infection. However, they were only using it for a short period of time, and it seemed to be helpful. From what I've seen, I don't think that there's any recommendation for the use of mouthwash daily. I've actually seen maybe quite to the contrary. And part of it is because of the microbiome. But the issue of oral health, I think, is a topic that really needs to be addressed, because the accessibility to oral care has been quite difficult, and has only been made more difficult, I think, in the last few years. And, you really do need to pay attention to your oral health. So if your gums are bleeding when you're brushing, if you have any, signs of gingivitis, you really do need to deal with that, because that does impact your whole body. And we've been talking here, Dragana and Graham have mentioned how the body is a whole system in itself, right? And everything is linked. And what happens in the mouth does affect other parts of the body. And so I'm repeating a little bit of what they said, but that's my knowledge on that topic. That interview with Dr. Graham Lloyd-Jones is still on the channel. You can go into the Friendly Pharmacy 5 podcast, or just under my interviews playlist. He really explains it very well. I think it's called COVID-19, the lungs, blood, and mouth connection. And it's really quite fascinating if you want to know a little bit more about that. And Dr. Lloyd-Jones will likely be coming back on the channel. He's just quite busy right now writing this book to just discuss this topic further. So thank you for asking that question as well. And we have a question here. Oh, this is not a question, a comment. Thank you for organizing these sessions. I hope you do more of these. You're a clear community. Oh, that's very nice. Thank you. Yeah, I mean, it's great that we've been able to do these, and it's been possible because of people like Dragana and Graham and Julian, who's in the background keeping us afloat here. So we really appreciate you joining us, right, and the ability to bring this kind of education to these platforms. We had another question here. Wait, sorry, just one moment. Oh, yeah. So hello from Elkhart, Indiana. Hi, nice to have you. I may have missed it, but what fermented foods do you recommend? Thank you so much. Dragana or Graham? Any?
I think we can both answer. So when it comes to fermented foods, I recommend all of them, whichever you like to eat, it's fine. But the fermented food is not going to be a probiotic. It might give you some live bacteria or freshly dead bacteria, but it's not going to be a probiotic. It's great food, easily digestible quite often. It's recommended to be part of the balanced diet, but it's not a probiotic. So I would say whatever you like, go for it. That's my recommendation. Not very helpful.
Yeah, and you mentioned in the book debate that was out where people would decide to use fermented food and prebiotic food instead of taking in the probiotic, thinking that this would actually give them the same thing in the end. So whether it was kimchi, sauerkraut, sourdough bread, all of these fermented foods that are out there. But Dragana's right. If we look at it like a medication, then we have to look at the exact strain, the exact dose, and how many a day we're giving. And so that's one side of it, giving an exact recommendation for an exact medical condition. As far as improving your gut health, there's a whole section there on fermented food and the benefit that it can have. There's no doubt about that at all. As far as clinical outcomes, I suppose, and what we've seen on presentations on here, how people that live in parts of the world that consume these things on a regular basis have a much more diverse microbiota than you would have in somebody that's, say, in a Western culture that's maybe eating fast food a little bit more often and not as much fermented food, not as much prebiotic, not as much fiber. So yeah, sure, there's no harm in trying to get the fermented food in there, but if you're actually trying to treat something, you need the actual probiotic that is recommended and that's been tested to work.
Very well said, Graham. Thank you very much for summarizing that. And you did a great job in the book as well.
Thanks.
I think there's even a list there of different, fermented foods and things that, just have a look at the book if you have it, or if you can get your hands on it. I know it's on Amazon. So I think that's it for our Q&A. And Lorena, I wanted to congratulate you because you are the winner of Gut Logic and Healthy Logic today. So if you're able to email me at friendlypharmacy5, what are we doing here? Sorry, friendlypharmacy5.com. We will get those books out to you quickly. So congratulations. Thanks for asking a question and for being with us in these sessions. So that brings to a close our Gut Logic series. Thank you, Graham and Dragana, so much for joining us. I know we've all learned so much, and it's been a real pleasure having you along and your willingness to even do this, because pharmacists don't usually do this kind of thing. So being adventurous enough to come online live and the audience as well. I just want to thank you all for being so respectful, having so many great questions. I think it's just been really fruitful overall. So yeah,
and that Friendly Pharmacy 5 site, I have to say, not because I was interviewed on it and Dragana as well, but like I've gone through all of these interviews that you've done, and it's like, if you think that the 10 sessions that we have done here are incredible, like there are so many more that you may not have seen, and you just go on YouTube and you see those, and they really are informative. Like, good on you for having that.
Yeah, absolutely.
Absolutely.
And the resource is there. That resource is there. And, hopefully you can find good evidence-based health education on there if you're a healthcare professional, or if you're someone from the lay public. I think that it's never been more important to be up to date with the latest information, not only to know how to advocate for your patients, but know how to advocate for your own health. And that's something we've been able to do in these sessions as well. So thank you all for joining us. Thank you, Julian, for operating behind the scenes and all that you've done. And we look forward to the next book. We've got to get to work now. So we got to go. Thank you so much. Take care and stay healthy.